Hi, I'm Leanne. It's nice to meet you.
Nice to meet you. I'm Nicole.
So today we're going to be doing some fitness tests. We're just going to start with one bike test. So in order to prevent cardiovascular disease, we need to start with having good cardiovascular health. And the best way to do that is to practice through aerobic activity or some sort of exercise that gets our heart rate moving and our blood pumping. So I'm going to test at what level you are right now by completing a sub-maximal test. So it's not quite a maximal test, so we won't be going all out, but it'll give me enough information to predict you what you would work at a maximal rate. So I'll start with taking your resting heart rate and your resting blood pressure before we take this test. So do you have any questions regarding cardiovascular health and exercise before I explain what the test is about?
I don't think so.
So this is going to be a bike test where we're going to probably be on the bike from anywhere from 6 to 12 minutes, depending on how your heart rate is. And there will be up to 4 stages, and each stage is 3 minutes. So at minute 2, I will check your heart rate. At minute 3, I will check your heart rate again. And in between that, I'm going to check your blood pressure. Okay. So there will be at least 2 stages, maybe 4, like I said, depending if your heart rate stays at a steady beat or how quickly it rises during your exercise. You'll be pedaling at 50 beats per minute. So I will set a metronome, which is a little clicker. I'll probably put it at 100 beats per minute, and that will just tell you and remind you that you need to be pedaling every time you hear a beat, because it's really important that you're at a steady state and that you don't increase the workload, because that might affect your heart rate. I will show you this to make sure you are on the right track and everything, and we'll get you seated on your bike so that it's comfortable for you. Do you have any questions so far?
I'm good.
Okay, I don't want to confuse you. Alright, so I'm going to explain another concept in this exercise test. So I'm going to ask you what your RPE is, so that's your rate of perceived exertion. So I'll probably just ask you how you're feeling, but I want you to say on a scale of 6 to 20. So 6 will feel like you're just sitting on a couch, maybe watching TV, eating chips or something. 20 is you're going all out, it's hard to catch your breath, you basically feel like you can't continue this anymore. And the numbers will be written on the bike with an explanation of what they mean, so you won't have to really think about it. I'll just ask you how you're feeling, and then you'll tell me. Okay. So a quick summary before we begin. This is a sub-maximal test, so you won't be going all out, but you will be going at the pace that I have you go, and I'll be able to predict your VO2 max, which is your maximal oxygen consumption, and from there I'll be able to prescribe you some exercises or at the right intensity that will be good for you to start with. So like I said, the test will be anywhere from 6 to 12 minutes, probably around in the 9-minute range. And all you have to do is make sure you're pedaling at a constant speed and you're breathing the whole time. Avoid holding your breath when it gets hard. And all I will do is just check your measurements. So you just need to focus on that. But if at any time you're feeling uncomfortable or you feel like you can't continue on, just tell me at any time and we'll just stop the test.
Okay.
So like I said, there will be about 4 stages most likely, and I'll be increasing the workload depending on what your first heart rate was, but I have faith that you'll be able to complete it. But like I said, if at any time it is uncomfortable for you, we will just stop, and that's fine. You always have that option. So no reasons that you feel like you can't complete this test today. You feel fine.
I'm good. We're ready.
Good to go. Okay, any last questions?
Nope.
All right, let's get started.
All right.